Hi there folks, Lyndon J here from Fascia Health and Wellness, and I've got a client, patient or student, whatever you want to call them, who's struggling a lot with their shoulder. This massage therapist is struggling a lot with the shoulders. You might have seen my previous shoulder video I did maybe a year or two ago. Basically, what we're trying to do is reduce inflammation in the shoulder and get everything gliding over each other. Again, when it comes to fascia, nerves, ligaments, tendons, muscles, what we want is things to be moving smoothly and gliding, and we want lubrication, and the only way to actually really hydrate the fascia, at least, is through movement. If you want to reduce pain through your nerves, also you've got to release a trapped nerve, but then you need to move and glide. So first, what we're going to do, I'm just going to take you straight through it. We're going to just do some warm-ups with the shoulder. So you might want to do this with music. It's really cool when I do my flow sheet classes. We do these things with movement. So what you really want to be doing is getting the full stretch through your back when you do this. So you're gonna stretch backwards. You can see the way my body kind of is stretching backwards. So you can do this straight on like this. Cool, and then you're gonna go the other way. So stretching over with that shoulder, and maybe do 3 on each side. You just want to really feel the stretch all the way through into the shoulder, so you're stretching all of the fascia all the way through your back, because the shoulder injury or shoulder issue is often not isolated. There's a lot going on, so it could be coming from your forearm, it could be coming from the actual shoulder itself, or it could be originating from your back, or even through your posterior chain. So that's a whole different video. Posture, balance, going through your hips, knees, feet, foundations, strong. But for now, we're just stretching up the shoulders, warming them up. So you can, basically this is the movement we're looking for, forward and back. And remember to stretch through the whole line, the side chain of your body, and also rolling that shoulder around like very dramatic kind of attenuated, exaggerated kind of stretchy movement that you want to be doing. Now that we've got some blood in the shoulders, we've stretched out, we've glided our fascia and our ligaments and our nerves and our tendons, now we can do a bit of stretching. It's actually better to do movement first before you stretch, and you might recognize these. They're very basic stretches that we used to do in the old school way of stretching. Old school stretching would have been like hold 15 seconds and stretch through it. Not that that's bad, but again, when we're dealing with injury and warming up, we want to do more dynamic stretching. So I like to pulse through it. So you pulse and you can feel the stretch in your fascia, and you can, if you've got music, you can go with the rhythm of the music, and then you do the other side, you'll feel when you do this, you'll feel your whole side chain of your body and your back stretching. So now we've really dynamically stretched the whole shoulder. Ooh, I even had a release. So again, your stretch now is more of an exercise than it is just a stretch. So you're still stretching, but you're also twisting your whole posterior chain. Remember, our fascia, it's like a spring, it's a coil. So we constantly need to coil it and uncoil it and encourage the kind of natural and dynamic movement that it needs to hydrate and get the correct energy pumping through it. And then obviously the thing with all of these movements and exercises is that what makes them so effective is because we're sitting in our desks all the time or in the car, and we're not moving our bodies. So we get very stagnant chi, we get stagnant fascia, which forms adhesions and stickiness, and that's when the pain starts arising. That's when the ligaments start getting inflamed and all these other issues, joints, it can spiral out. So this is why it's important to move, keep moving, keep flowing. Okay guys, and here's just another exercise for these shoulders. So often what we feel when we feel pain in our shoulders, it could be a pinched nerve or slightly obstructed nerve. So there's a technique that's all the rage at the moment. It's called flossing. So this is flossing. So you're basically going to throw your arms back like this and then bring them back up. And that kind of internal rotation like this. You can change the angle up, and as you start to get a bit more comfortable with it, you can speed it up. So you also flinging out any tension. Don't forget to breathe. Remember to take note of your pain levels. If you're anything over a 6, you've got to dial it back a bit. That's that. You can change up the angle a little bit, bring it back even. And maybe it feels better to just do that. This is again opening up the pectoral, which is another important muscle we mentioned earlier on. You want to open that up, and then you can also, football players, when you're protecting the ball, you're pushing off other players behind you. So again, you just come back in, and this is a shoulder flossing technique. Okay, next one. This one's really great for reducing pain. This is the levator stretch. Often when we have shoulder issues, it's actually, you might feel it over here, like maybe there's a thick knot here that's just terrible, and maybe you're feeling it in the point of your shoulder, or maybe in this little point here, or perhaps sometimes it might even be your pectoral, so you can also stretch that out. What often is happening is that it's your levator, so it's got to do with your neck and runs all the way up. So we need to free up that levator so that we can allow for the rest of the shoulder to be more dynamic and not overcompensate in other areas. So what we're going to do, you'll find with a lot of shoulder releases, you'll find that we tense up, and this is actually also like an important sensation, is to like kind of feel, okay, this is what tensed up feels like. Then you let it relax down, you pull it away from your ear, and then you get that stretch over on your neck, right? So that's your levator stretch. You tense up, you pull away. Tense up, pull away. If you want to take it to the next level, you tense up, pull away, pull that stretch out, right? Other side, tense up, pull away, tense up, pull away, tense up, and pull away before advanced. And one thing you might find with this is you might feel a lot here, and feel a lot of little cracks and crunches in your neck. Those are all kind of releases that are happening on your spine. What you want to do is, if you have a spinal injury, just be really careful. Anytime that you have pain in your body, anything over a 6 out of 10 of pain is a bad thing. So you want to keep that pain as close to 0 as possible, if possible. Like 5 and downward is good. Just to take this one to the next level, this is also an important exercise, is to tuck the chin in. Because remember, we're trying to correct posture. Is also really important. One of the key pillars of Tai Chi is posture. So same thing when you're doing therapeutic workouts, you want posture. So putting the chin back, you can do the same thing, tense up and separate. See if you can keep that chin tucked in. Maybe just putting your hand there to make sure. And then if you want to go advanced, you can pull it over. This, when you pull your neck in, you might feel different sensations about where you're feeling the stretch, but just know you're stretching that levator muscle, you're releasing tension in that levator, and you're freeing up sticky fascia. Cool. So that's that one. And if you want to take it to another level, you can tense it up, look away, and you can look down, drop away. That might just give you a different angle. Remember, being dynamic, changing up the angle of your stretches and your exercises. And you can also get a bit creative with that. Just always beware pain and maybe the limitations of what your body can and can't do. So always be knowledgeable about your own body. You are your own medicine, guys. And we have a responsibility to exercise that. So great. Hopefully that's helped you out in terms of freeing up your shoulders. Some really great dynamic exercises to help you get you back to being pain-free and operating at optimal levels. So don't forget to keep moving, and for next time, come flow with me and rise with Chi.